I'm Ali Velshi in Paducah, Kentucky, part of a week-long tour across the heartland of America with the CNN Express. We're talking to Americans about health care. We're trying to get away from the noise of those town hall meetings you've heard. We're trying to get through the filters right to people to find out what they want in terms of health care and what they're understanding about what's being proposed. Let's start this discussion. We are hearing different things from people wherever we're going, but I haven't found too many people around here who are opposed to reforming health care.
I'm for the idea, but I don't think that Congress and the President has done a good job of disseminating information. I'm just hearing a lot of flack and not a lot of meat and potatoes.
What about you?
I think right now we have a lack of choice. I mean, healthcare is expensive. I mean, the average costs of the coverage I found more often than not are more expensive than the actual care. I would think any choice, any viable choice would be better than what we've got now.
What do you think?
My understanding, there's about 48 million people that's not covered. Those people need to be covered.
Well, my husband and I are two of the 47 million plus that don't have health care. And I'm not talking insurance. Of course we don't have insurance, but I want health care. My husband has diabetes and he just had a bout with cancer. What insurance company is going to cover us? There aren't any. If I get sick today, where do you think I'm going? I'm going to the emergency room. Who's that costing? That's costing us, the taxpayers. So if it's going to cost my bottom line, if they have to tax me more in order to get health care, tax me. Tax me, tax me, tax me. I am willing to pay.
Let's talk about the 46, 47, 50, whatever million you want to use, number of people who are not insured in this country. What's your thought on that?
Oh my God. I can't believe you're saying that people don't deserve health care if they can't afford it.
Where did I say that, Heather?
That's what I hear you saying.
Then you're not listening, Heather.
Yeah,
I said
well, you did say that you'd like to buy a Hummer and you can't buy a Hummer because you can't afford it. So you're saying if you can't afford the Hummer, you don't drive it. If you can't afford health care, you shouldn't get it?
No. I'm saying you have the basic stuff. You get a catastrophic illness, you're in a car crash, an accident, something like that happens. Of course you get coverage for that.
There's disagreement here, which, by the way, I didn't sense when I first got here. So it's a good debate, but this appears to be a healthier debate than a lot of the town hall meetings that some of you have seen on TV, which has not been getting to the point of debate. It's a shout fest right from the beginning, and there doesn't seem to be a hearty discussion. Why?
It seems it just distracts from the issue, and it's really disturbing because this is a complex issue and it's something that's going to affect us, for the next generation. And so, I mean, we really do ourselves a disservice when these town halls. I saw one with Claire McCaskill today and the one in Pennsylvania. I mean, there's just, this is a very complex issue. Our health care is 16% of our GDP. It's way too high. We're higher than any industrialized country. And yet, when we're trying to fix it, we tend to revert to this, I don't know, lack of intelligence, and it's really not doing anything. It seems like
what's the problem? Is it people don't know what it is? Is it they are not able to research it? Is it, as somebody told me earlier, that it's radio that's influencing this? Is it the media coverage? What? We're afraid.
We're all afraid that we're going to lose something. We're all afraid that my ability to keep my doctor, keep my insurance if I want to, I don't know that many people actually believe that that's going to be the case.
But they've said it.
Yes.
People have said that.
Yes.
May not be able to get
Politicians going back on their promises
to begin with.
Come on.
Well, do you think the administration's doing a good enough job? And what else can they do to sell this?
Well, I am a fan of the administration, but they are not doing a good enough job at winning the battle on PR. Honestly, I mean, I personally like the single-payer plan better. But honestly, whatever they put out right now, if it got passed and if every single American was guaranteed health care, that would be good enough for me.
I feel like we're here not listening to extreme positions, we're listening to what real people have to say. So this is part of our effort to broadcast this and have people all over America say, wow, that probably sounds like my community. We've probably got ideas. So I thank you for this. This has been a very productive discussion. I hope it'll continue in your community, and I hope we can have this continue on a national stage. I'm in Paducah, Kentucky, in western Kentucky, as part of our trip through into the heartland of America. We started in Georgia. We're going to end in Iowa, and we're going to be doing this wherever we go. We're going to be having conversations with real Americans about what they feel about health care and health care reform.